Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Cleveland State University, Robert Conrad, and the Payne Fund.
Good afternoon, and welcome to the City Club of Cleveland. I'm Kristen Baird-Adams, the Vice President of the Board of Directors of the City Club and Chief Operating Officer of the Office of the Regional Presidents at PNC Bank. It's my pleasure here this afternoon to introduce our conversation on healthcare reform featuring Dr. Toby Cosgrove, President and CEO of the Cleveland Clinic, and of course, Ohio Governor John Kasich. Healthcare reform, as all of you know, is one of the most contentious and divisive issues facing the federal government. This has been the case in America long before the current administration. The Republican Party, as you know, for years has lobbied, as one example, for the repeal and replacement of the Affordable Care Act. It was contentious when it was passed 7 years ago, and of course there were healthcare reform efforts that did not succeed prior to that. On May 4th of this year, House Republicans passed the American Health Care Act, or I should say the House passed the American Health Care Act. The Senate has yet to vote on the House measure, and leaders have indicated that they might produce a different replacement bill. While healthcare reform is on the minds of many Americans, it's especially pertinent for those of us here in Ohio, given the national reputation for excellence so many of our healthcare systems, including the Cleveland Clinic, hold. Under Governor Kasich's leadership, Ohio also took advantage of the Affordable Care Act's Medicaid expansion, and as most of you know, that has provided coverage to some 700,000 Ohioans, including 100,000 residents or so right here in Cuyahoga County. According to a recent study from the Ohio Association of Health Plans, Ohio's Medicaid expansion has saved taxpayers $1 billion annually while providing health care to roughly 3 million Ohioans. So as the country is on the verge of another attempt at healthcare reform, it is fitting that we have these two very distinguished speakers with us here today who are so well known that they hardly need any introduction at all, but I'll give it my best shot. As President and CEO of the Cleveland Clinic, Dr. Cosgrove is accountable for the performance of the $8 billion healthcare system comprised of the main campus, of course, right here in Cleveland, 10 regional hospitals, 18 family health centers with locations around the country and in Abu Dhabi. He took the helm of the Cleveland Clinic in 2004, and the last decade has perhaps been the most successful in the healthcare system's history. Earlier this month, Dr. Cosgrove also announced his planned retirement from the Cleveland Clinic. John Kasich was sworn in as Ohio's 69th governor in January of 2011. He began his service to the state in 1979 as the youngest elected senator in the legislature's history. He also served as a member of Congress, as most of you know, from Central Ohio for 18 years, and as chairman of the House Budget Committee, led the effort to balance the federal budget for the first time since 1969, and also helped enact welfare reform. He has twice been a candidate for president, most recently in this last year's campaign. The philosophy driving his candidacy is laid out in his new book, Two Paths, America Divided or United. Dr. Cosgrove and Governor Kasich, thank you so much for taking time out of what we know are extraordinarily busy schedules to join us for what I'm sure will be an engaging discussion as moderated by the City Club's very own Dan Moulthrop, who of course serves as our CEO.
Thank you. Thank you very much. Governor and Dr. Cosgrove, thank you so much for being a part of this today. Governor, I know you have a lot of questions you want to ask Dr. Cosgrove as well, but I know that
Do I get to ask him questions?
Yes, yeah, that's part of it. But I wanted to start just with the AHCA passed on May 4th by a narrow margin with 20 Republican members of the House voting alongside the Democrats and against the bill. There's now work to be done in the Senate. What's the best case scenario? What comes out of this, Governor?
Bob, no, we don't have a clue what's happening now, and things are chaotic, as we know, and I don't know. I mean, we just have to see how things develop. I mean, I'm hoping that we're going to be in a situation where there'll be great concern about the people that get served in this program, and that it not just be about fulfilling a campaign promise. And there is reform that can happen in this, and I hope that they'll look beyond the numbers and into the impact on people, Toby. That's my concern. You know, it's easy when you're down there, because I was there. You know, they're not very much in touch with reality in terms of what happens on the street. Well, what I mean by that is you might as well be on Mars, because you're down there in a place where, you know, it's a lot of theory, and I've got to, you know, make this number and that number. But I was there, I understand it. But in the course of it, you don't really ever understand the impact of what happens. Now, they can make a visit to the clinic, you know, and come up and talk to you for an hour, and then they go back. But they don't get right down to serving people. So it's sort of like Toby and all the great doctors at the clinic have to deal with people when they come in the door. They understand what healthcare is all about. And as a governor, I understand. I mean, people clap because I expanded Medicaid. I mean, I should have been run out of the state if I hadn't, because how do you turn down a partnership with the federal government to cover 700,000 people? No, there's way to, it's not a big deal. So I mean, I got points on the board as a result of that. I probably get a view of the golf course in the next life. But what I'm concerned about is I was telling a senator the other day, you know, you could add 50 billion. We put 50 billion more in. You might as well spit in the ocean. That's 50 billion. My God, we put 50 billion more in. But that doesn't mean that they covered anything. It's just a fraction of the overall cost. Now, the problem, I'm going to be quick because I've got a lot of things I want to ask the doctor about that is beyond the politics of this, and we can take questions from all of you. You know, this is about insurance coverage, but the real question is, how do you control healthcare costs? That's what it really gets down to. So I hope that they can take their time, do this right, bring more Democrats in. That'll moderate the bill, but we'll see. No one knows. There's 13 people looking at this thing, and you know, I just can't predict, and I don't want to give you cause for concern. I don't want to give you false hope. I don't know. Be interested in what the doctor says.
Yeah, well, I'm a little concerned about the bill, quite frankly, because I think it's not getting to the root cause of the problem. And the root cause of the problem is the expanding cost of health care. And we're all dealing with, in fact, every country in the world is dealing with it for two very straightforward reasons. One, more older people. And two, more things we can do for people. And all of this is driving up the cost. And, you know, we'll have plenty of money in the system and won't have to shift it around if, in fact, we manage to take the costs and contain the growth of that cost. And there's a couple ways you can do it. A, we have to have a more efficient delivery system for people who are sick. And there's a lot of administrative things and legislative things we can do to that. For example, just on the regulatory things, we in the last 2 years have had 14,000 pages of regulation from CMS. It makes great reading. The second thing is that, you know, we have virtual medicine. If you want to do it across the country, you've got to be licensed in all 50 states. We have no interoperability of electronic medical records. You know, we have no cost containment in terms of the continuing growth of pharmaceuticals, which over the last year, we have gone from spending $250 billion to $360 billion for pharmaceuticals across the country. And so we've got there's a lot of things that the federal government can do to improve the efficiency, also allow hospitals to begin to come together into systems. Every hospital in the United States grew up as a individual community hospital, and now, like every other sort of organization, be it supermarkets or bookstores or law firms, they're all coming together and consolidating for efficiency reasons. Then on the other hand, the other big thing we have to do, we have to control the burden of disease in the United States. Obesity. 30% of the United States is obese, accounting for 10% of the healthcare costs in the United States. We still have 18% of the people in the United States smoking, the biggest preventable cause of cancer. And then we have an epidemic of opiates. The other day I was in Washington, I visited the Vietnam War Memorial. 53,000 people died in that war. Last year in the United States, 53,000 people died from drug overdose. Horrible. So we have got to control the burden of disease, and if we could get to a bipartisan bill to begin to, if it was labeled, how are we going to reduce the cost of health care? And it's perfectly possible to do that.
There's a working group in the Senate, 11 senators, including Ohio Senator Rob Portman, who are focused on dealing with the AHCA and moving some sort of legislation forward in the Senate. Any of them calling you?
No.
I know you have questions, Governor
Let
Kasich.
me just say to Toby, obviously, I think it's a two-step process. One is get the insurance stuff, get everybody covered, and that's the first thing. Then the second thing is how do you go about dealing with these fundamental problems? We have worked in Ohio with the clinic on paying for value. We measure, and we have to have the medical personnel in the middle of it, and we are going to pay people for high quality and low prices. This has taken us 2 years, I think, maybe even a little bit longer than that, to get everybody at the table and to agree. So you need the insurance companies, you need the providers, you need special interests, everybody around the table. To me, the problem is there's so many special interests that disrupt the process. And what we need, doctor, is we need people who say, look, I hear you, I hear you, I hear you. Good, good, good. I've got this group over here that I'm also working with, and this is what we're going to do. And then we go and we do it. The problem is it's politics. Well, we can't do that because that upsets this group, and you can't do this because that upsets this group. And, and we got all these regulations coming in. Okay, make it simpler. Either we trust you or we don't to some degree, right? We don't trust you at all, so we have all these regulations. The problem is we're tied up in knots. And it's because the people who are the leaders today seem unable to break through the morass of the conflicting special interests to actually come up with a plan that works. And when you let politics be the order of the day and you're worried about, who's going to like me, who's not going to like me, you lose. And that's where we are today, and it's not the kind of leadership we want. So if we look at the clinic, I tell you, I get treated at the clinic. I first got in touch with the clinic through Mal, through Dr. Loop, and I have been going to the Cole Eye Institute since 2001 for high pressure in my eyes. I can't believe the job they do. I've had friends that come up here and had open heart surgery. I just was talking to Dr. Cosgrove about this the other day. My friend, it was like magic. The doctors, they all care. And I'm like, well, are you only caring because I'm the governor, and when I'm not the governor, I ain't going to get in, And I mean, I know how it works, folks. Okay. Enough of that. But Dr. Cosgrove and Dr. Martin have both told me the same thing. We don't care if you're digging ditches or you're the President of the United States. Everybody gets treated the same. How have you been able to maintain that quality? And how have you been able to put together a team that has been able to be so amazing? The clinic is incredible. So how has this happened? And what happens going forward?
Well, I think the first thing that we did is we defined why we're all there. We had disparate groups, some educated, some researched, some looked after patients, some administrators, some drove buses. Only reason everybody's there and the only reason we have a clinic is for patients. So our mantra became patients first, and everything else sort of filtered down from that. How we organized ourselves, how we made decisions, and where we put our money. And if you realize if you got a North Star that really guides you, I think that helps define the entire organization and lines everybody else up on what they do and why they do it.
Have you had to use a heavy hand at times?
Well, the hardest part was bringing along the doctors. And when we said it was patients first, some of the doctors said, what is it, patients first, doctors last? So we took a little time to get over that. But I think,
Yeah.
I think, I frankly think it's now, it's a part of the culture. And I think people respond to that. And it has been really terrific in defining difficult questions and how we answer them.
My observation is you have to stay on top of it, because in our administration, we don't really care much about politics. And what you worry about is, can that culture be tapped all the way down? And that's a challenge.
Well,
right?
the other thing we did is we realized that everybody in the organization is a caregiver. Doesn't make any difference. You drive a bus, you deliver food, you're a neurosurgeon. Everybody's there for the same reason, and that brought the engagement, and that brought everybody on board to do that, and that all begins to fit with the culture of the organization.
Two areas I want to ask you about, because you talk about addiction, and as you know, I love to talk to you about the development of the brain. Where are we in terms of brain development as it relates to Alzheimer's or ALS or addictions, or we're beyond prehistoric barely, right, with brain? Where are we?
We're substantially beyond it, and I think probably if you look at where I expect the big breakthroughs to happen over the next 15 or 20 years, I think it's going to be in the neurologic area. And one of the things that has done it is functional MRIs, and you now can tell where portions of the brain, how they work, when they work. For example, they figured out that I'm dyslexic and my brain works differently from looking at a functional MRI of it. So now you can have surgical approaches, you can have electronic stimulation, you can have medicines, and you can tell what part of the brain they're working on and what the effects are. For example, we recently did a sort of a first. We're beginning to put, as you know, you can put pacemakers in people's brains for Parkinson's disease, and they can go from being absolutely uncontrolled to absolutely normal with that pacemaker. Now we're starting to use it in other areas. Starting to put it in people who've had strokes to help them recover from their strokes. We're starting to see it in addiction. We're starting to see it in depression using that. So I think that's where we're going to see major steps ahead. But I have to point out that the two areas that I'm most concerned about is at the two ends of life, Alzheimer's disease and autism. And both of those have tremendous economic and social and emotional implications for our society. Right now, 1 in 55 births is autism.
Why is that, doctor?
We don't know. But it certainly is. It is not from vaccines. That's clear.
Thank you for saying that.
By the way, this year we now have covered almost the entire population with health insurance for people who have kids with autism. We hadn't had it in Ohio. We were one of the few, and step by step we got that done, and that helps a heck of a lot of families. I'm proud of that. So where do you see these two ends? So in PICO, everybody's worried about Alzheimer's, right? Either themselves or their father, their mother.
If you get to be 85, your chances of getting Alzheimer's disease is 1 in 3.
Really?
Yes.
1 in 3.
1 in 3. So I mean, you imagine the financial.
That's
terrible.
Just shocking, isn't it? 1 in 3.
Yes.
Holy smokes! So what do you see?
Some people get it earlier, John.
Wow.
That's not funny.
It's not funny, but it's funny.
So I think that the thing that we're beginning to realize is a lot of this is associated with inflammation. And so the sort of things that you avoid inflammation in terms of food, obesity, exercise, et cetera. It seems to reduce that. But right now, they've gone through over 30 different drugs. Every one of them has not shown any breakthroughs.
So is it money?
No, it's not money. It's science.
Well, that's what I mean. But do we need more money in the science to?
Well, as you know, I mean, this gets down to the NIH and the funding of the NIH, which has now been flat essentially for 8 years, 9 years. It went up, and the recent budget is about to take it down again.
Yeah.
So we'll have to see how that is. But you know, the investment in the NIH research pays dividends and more than 2 to 1 for what it does to society. In fact, if you look at the economics of increasing age, a lot of people think that 50% of the growth of the GDP is because of the increasing length of people's age. At life expectancy, because they contribute more to society, they buy more things, they continue to stimulate the society.
You know, this is a case, though, Doctor, where my opinion is you and the great CEOs around the country and the people in this room, for example, you've got to tell the people that represent you, we got to have significant increases in NIH. When I was Budget Committee Chairman and we balanced the budget, we had significant increases in NIH. That was a time when it probably got raised more than any other time in recent history. But when you use statistics like 1 in 3 at the age of 85, you know, first of all, you got to pound on the people that represent you, and they got to say, I'm not voting for anything until we get the increase in NIH. And then I think you folks have to just make it clear that continued flat funding puts Americans at risk, and it's not acceptable. It's not like it's that much money compared to everything else. You know, I know they want to increase defense spending. I'm for it, but why don't they clean up some of the stuff that's going on and put the money in NIH? It's all about priorities. So I'd really urge you to do that because it could make a big difference. Do you have a group that meets and talks to the leadership?
Absolutely, we do it. And as you probably know, I've been trying to help the president sitting on some of his advisory groups.
How's that going?
Yeah.
I want to ask a couple other
Can
things that I wanted to ask about.
Just on this issue
Yeah.
of Alzheimer's and inflammation, just to, somebody else
know
will
who's
bring it back
listening.
up. But it seems to me, I mean, inflammation is kind of a very general category of like everything that ails us. But it would seem to me that preventative care and pediatric care would be pretty key investments to be making now to avoid Alzheimer's down the road and lower the rate of Alzheimer's.
Absolutely, and I think, you know, if you look at sugar, that is one of the main issues that we have to deal with. And it's driving the obesity epidemic across the United States. And, you know, you could do a lot in terms of reducing the input of sugar into almost everything we eat.
Mm-hmm.
You know, Dr. Roizen, you know, and Mr. Ratner, you know, I'm his protege, tried to get me to make Roizen a lieutenant governor and run everything on health care. No, I mean, but I was talking to Dr. Cosgrove about this earlier today, because Roizen is a big believer that what exercise, eating, and everything else, and you just saw a lady died at the age of 117. And, you know, I mean, we see this age really creeping up, and at the same time, you've got the conflict with Alzheimer's. So talk a little bit more about what we can all learn, what we can do, and what we can tell our mothers and fathers to do as we want to live longer, because clearly it's happening.
Well, I think it's pretty clear that, first of all, weight, exercise, no smoking, stay away from the drugs, and, you know, increasingly, you know, sleep.
Sleep. So how much, when you say sleep, that's now starting to emerge as something people are beginning to talk about.
Right.
Talk about sleep. What does that mean?
Well, there's no question that the body has to be revitalized. And, you know, one of the great advantages is I can go to sleep almost any place, anytime.
We'll try to keep this lively for you.
Thank you very much. I think it's a holdover from surgical residency program, actually.
Gotcha.
You're still sleep deprived?
Still sleep deprived.
How many hours do you think? Whatever your body takes?
Well, 6 to 8.
And what about exercise? Because, a lot of people, they don't know how to do. They say, well, I've never exercised, I'm older. If I go to the gym or something, people are looking at the way I'm dressed and all that stupid little thinking. But talk about exercise.
Oh.
How vigorous? How far? Walk 2-3 miles. Does that matter?
Well, we talk about pedometers and get your 10,000 steps in every day. That's plenty exercise, and you don't have to be dressed anything special to do that.
Good.
Governor Kasich, I have a question for
Yeah.
you about your colleagues across the state, other governors. I know that you're in contact with many of them regarding the future of health care, Medicaid, and so forth. What are you hearing? Are you finding also that you have allies?
Well, look, my staff's been very involved in, Greg Moody, who works with me, is really terrific. Barbara Sears is here with us today. She runs Medicaid. We had a set of principles that we agreed to a couple months ago, and there were at least 21 governors that agreed to it. I then took then the principles seemed to disappear, and then I put a letter together and offered it to the 21 people who were all in agreement with it, and I ended up getting 4 to sign the letter. And then there's some of them who are in states where to not sign the letter is just completely nuts, and they didn't even return our phone calls. So there's a sort of hiding, if you're not for what the president wants or what the House Republicans want or what is happening back in your district, well, then, you might get a lot of heat, and why is he not with the team, and I have to run for re-election, and am I not going to get the Republicans to support me? And by the way, this works in both parties. I did an event yesterday with Mike Coleman, and as many of you know, I didn't go to the convention here in Cleveland. I never endorsed Trump. I root for him now. I want him to do well. I mean, just like I root for the pilot on my airplane. I want him to do well, okay? But
Mike Coleman is the mayor of Columbus.
And Mike Coleman said, if I had done what you did, they would have hung me, driven me out of the Democratic Party. It infects both parties. The inability to want to step out and carve a niche for what you think the party ought to be for. And so it was a little frustrating to get a total of 4 out of the total number of governors that we had. And then I've been talking a little bit. I had one call with the governor of Colorado, and now they're reaching out to us, and we're at very broad principles.
The governor of Colorado, we should say, is a Democrat.
Yeah, he's Democrat. There's 3 Democrats now, 3 Republicans. Is that right, Barbara? They're all kind of talking, but we start with like basic principles. Is it better to have sun than rain? Yeah, we can all agree with that. But the minute when we say how much, it starts to break down. So we have to have somehow a coming together of some basic principles and some basic ideas about what needs to be done. I will tell you that the marketplace is not working. Insurance companies are dropping out. In most of the counties in Ohio, we have 1 insurance company. So we know that has to be fixed. Medicaid expansion, we're covering a lot of people. So could you move Medicaid expansion down to the regular, you don't want to know this, but there's a match. We have to put so much in. This is 90-10. Our match is like 60-40. Could you take the 90-10, relieve the burden on the federal government, move it closer to where we are, to the traditional match? Could you do it? Absolutely you could do it, but it's going to take time. He hit on another issue that is really critical for us here in Medicaid, and that is the pharmaceutical problem. And because of, again, it's like both parties, because the Democrats said you must cover every drug, we have no leverage. So if somebody wants to charge us a high price, we can't say, well, we're not going to take it. So I suggested to the president and a whole bunch of people that what we do is we have the ability to drop a drug from our formulary. And the minute we can drop it is the minute we got negotiating power, and they're going to bring their price down. Now, we're not going to go out and destroy the pharmaceutical industry. He'll be the first one to tell you the things that they've done, or look at what they've done on some of these diseases. Hepatitis C, what, you got to treat it for that forever, and now they can cure you in 4 or 5 years. And I mean, look at what it's done for mental illness. Look at what it's done for so many things. But at the same time, there has to be a more robust marketplace and giving us some leverage. And I think that's what he's talking about. And I think we can do that, and it's not anti-pharma, But the pharma lobby's pretty darn powerful, and I don't want to destroy it. So the question is, how do you get all these pieces together, get common agreement, and say, let's get the insurance piece done, and let's begin looking at healthcare? And the reason why I was talking about, see, we're now beginning to pay primary care doctors for doing a job to keep us healthier than what was normally expected. We give them a reward. It has taken 2 years. That's where I think we go, right? Pay, and you guys have been involved with it. Pay for quality at lower prices. Transparency.
So let's go back to pharmaceutical again for a second. I think you make it a very good point. You know, you're talking about could we get pay for pharmaceuticals the same as the Veterans Administration does, and that would drop our pharmaceutical costs substantially. Now, there's sort of two groups in the pharmaceutical industry. The group that has, for example, the EpiPen, who raised the price 500% in 1 year. There's a group of those that I think, frankly, are unethical. Then there is the major pharmaceutical companies who are still raising their prices 10% a year, way beyond what is going on with inflation rate. So, you know, there has to be some common ground where we can get the unethical companies and control them and then have modulation in terms of the inflation and healthcare costs. You know, we saw our pharmaceutical bill go up 19% last year. And
What did ours go up, Barbara?
Close to 19.
So it is a significant issue for us, but you're exactly right. We need to go to, instead of being paid for volume, to be paid for value and keeping people well, keeping them out of the hospital. And interestingly, over the last 10 years, by a combination of wellness and not hiring smokers and giving people exercise and the proper foods, et cetera, and then disease management for people with asthma and hypertension and cholesterol, et cetera, we were able to take the healthcare cost inflation rate and going from 7.5% up to flat and then down last year 2%. So you can do it.
Yeah, our Medicaid program, when I came in, was going at 9%, and now it's at 3%, and the per capita rate is flat. But we had to challenge some of the special interests, though, Doctor, who didn't like the idea of people staying in their own home rather than being sent to nursing homes, and lots of things like that. You know what, I want everybody here to know, all these things are doable. They're vexing, by the way. You can't take a pill and achieve it. You can't have an app and achieve it, and it doesn't get done on a bumper sticker. You know, today, if you run for office, you got to have bumper stickers. You know, you got to have a bumper sticker line. You got to disrupt and all this stuff. But these things can't get done. But if I sat down with Toby and people around the country and people from the industry or whatever, we could figure out a way to do this without destroying the market. But doing what we're doing now is just letting this problem get worse and worse. I mean, it can be done, no question. But you've got to be committed to the public interest and living a life a little bigger than yourself.
We're going to go to questions from the audience in a second, but the original reason we were all going to get together, there was going to be a fourth chair on the stage for the ambassador from the United Arab Emirates, who was recalled for the Arab States Summit that's happening in the next couple of days. Toby, the work that you and your colleagues have done in Abu Dhabi has been incredibly innovative, and I know you've learned a lot by sort of reinventing healthcare delivery there.
Well, we've had a wonderful opportunity to be in Abu Dhabi and over the last 10 years built a facility there which is really second to none any other place in the world. And it has been a wonderful opportunity to take the Cleveland name and take it out of the United States, and we are appreciative for the UAE for that opportunity. We now have 4,000 Cleveland Clinic caregivers there, and the next question everybody asks is where the doctors come from. Actually, we had 12,000 doctors apply for privileges. We hired 300 of them, 80% from the United States, a third from Cleveland, and 20% from Europe. This is a terrific group, and we are delighted with our relationship. And we're delighted to have our friends from the UAE here today because they have today donated a soccer field to JFK High School here in town, and we're most appreciative of that. So thank you very much.
but we want more, okay?
And
Can I
we'd
wanna
like the
say-
ambassador to come back and speak.
I'd like to just say one thing, because I'm thinking here about the clinic, the value, the political problems, EpiPen, Wells Fargo, all these kinds of things. I just want to say very, very quickly, my greatest concern for the country is, and hold on and don't get uptight here, is that I think that we have been systematically drifting towards a secular society in exclusion to the power of faith in a creator. Now, when you say religion, of course, it gets everybody uptight, but I have to tell you, religion, I don't care who you're sleeping with. Doesn't matter to me. Religion, to me, is not about the condemnation. It's about the unity, living a life bigger than yourself, connectiveness, family, and love your neighbor as you love yourself. We can do all these rules and all these regulations, but you see, what they're doing in a clinic is he doesn't have rules. He's got a virtue and a value system that says you, the patient, comes first. So if you sit on a pharmacy board, don't you have an obligation, or if you're in that business, don't you have an obligation to consider the folks? Don't you have an obligation to think of the morality of it? And I believe as we have turned more and more secular, our value system has become subjective and not objective. So in other words, there's no clear standard. Well, if you do it, then I should do it, and hey, I'm right, no, you're right, no, you're wrong, no, you're wrong. There's no compass. It's like being in the middle of the woods lost without a compass, a true north. So I think we have to reflect on this because it affects all of our lives, and I happen to believe that the health of a society is determined by how much of the time the average citizen, which includes me, lives a life a little bigger than themselves, because most of the time we don't. And sometimes we even live in the basement, okay? And I do. I'm guilty. But we know our responsibility is higher. That's how we're remembered. That's our legacy. That's what will be his legacy, what he did to leave a value system in place. And so what I'm suggesting is we all better think about this, because the constant drift away from a center of virtue puts, I believe, our country at risk in many different ways.
That's Ohio Governor John Kasich. He's in conversation with President and CEO of the Cleveland Clinic, Toby Cosgrove. I'm Dan Moulthrop of the City Club of Cleveland. We're about to begin the Q&A, and we welcome questions from everyone, City Club members, guests, students, all of you, any of you joining us via our radio broadcast, our webcast, or our live simulcast at the Parma Snow branch of the Cuyahoga County Public Library. May we have our first question, please?
Good afternoon. My name is Merle Johnson. I'm a member of the State Board of Education, and I'm so glad that you're here today. I want to move in a different direction and talk about the health of our public schools in Ohio. The Fordham Institute recently found that students in the voucher schools are doing considerably worse, and that's a quote from the report. We find that our charters, even though there are some wonderful charter schools, 2/3 of them are failing, but at the same time, the Republicans are still pushing school choice. And so my concern is that we have 92% of children in our state that go to public schools and need the best public schools possible. My question to you, Governor Kasich, is when are you going to apply that same wonderful compassion that you have for Medicaid? When are you going to apply that to the state of our public schools? Because our children, 92% of them deserve the best schools possible.
Mm-hmm. Well, look, we have the highest level of funding that we've ever had in our history, number one. Number two, I believe in choice, the same way that I know that if you don't have any choice, you have a monopoly, you don't get the improvement you want. And I was just with Abigail Wexner, who just started a charter school, and it's incredible what's happening. And I'm very aware of the Catholic school that puts kids out into the community, and they go to work. I don't know how, Cristo Rey. We just had a Cristo Rey school that graduated. 100% of their kids have all gone on to college. I'm a believer in choice, but when it comes to charters, they need to be held to the same high standard of the public schools. But let me just suggest this to you. Within a relatively short period of time, the number one occupation in this country, driving, we won't need drivers, okay? We will have autonomous vehicles, and all those people you see driving around in trucks will not be driving around in trucks. What's going to happen to them? Think about what's happening with drones. Think of how the impact that is on so many facets of our life. Even think about the grocery store business. You know, Watson, artificial intelligence, you know who Watson is? You know what that's going to mean for stockbrokers and insurance risk adjusters and all these folks? We are going to see a tsunami of a tsunami of confusion and significant impact if we don't prepare for the dramatically changing digital economy. We went from agriculture to manufacturing now over to the digital economy. And let me ask you this question. Are we in the public schools today, both in K through 12 and higher education, preparing our kids for the future, for having 8 or 9 different occupations over the course of their lifetime? Are we preparing them in a way where they have real work experience, where we have flexibility, where schools are out there trying to get kids out to places like the Cleveland Clinic to understand the real world? You answer that question. Do you think we're prepared for this digital revolution? I do not. And I don't think it's just about money. I think it's about a whole variety of things. And if the schools don't change, these schools will be disintermediated. We will begin to do competency-based education. Employers will be educating people online. We will see a dramatic change that can save us from a tsunami of job loss if we don't meet this. And so I think we should be moving forward with all kinds of different ways to think about how the best way we can educate our children. I was involved in the Cleveland school reform thanks to Mr. Ratner, and we have significant things happening here, but we have a long way to go. And the one thing that we all know is the more we can get kids out of a situation where education is disrupting the ability of kids to learn. Hear what I just said? Where education's getting in the way of learning, we're not going to make it. Now, I'm going to be out of office in a year and a half. This is my Paul Revere warning. We got to stop squabbling about this stuff and start thinking about new ways to get kids out there, get the skills, get them inspired, and the old way is not working anymore by and large. So we have bigger issues to fry than whether we got school choice or don't have it, or charters or vouchers or whatever. The problem is it is a constricted system that does not like change. Just ask Ratner how tough it has been to change the Cleveland public schools, even at times when they are failing. We've got to put our kids first. Just like Toby puts the patients first, I want to put our children first. And that means a dynamic and changing and different public school system. Finally, you realize that AT&T works with Georgia Tech. And you can get an advanced computer science degree for $6,000. You can't get where do you go to school in Ohio? What do you think it costs it up here at Case to get a master's degree in computer science? What do you think? We're going to head towards competency-based education. We're going to face more online education with a real college and real world experience. And if we don't do it, we are going to see division and job loss like you can't imagine. We need to get ahead of this before we see the tsunami.
Well, part of the things that contribute.
I feel very strongly about this.
Yeah, and one of the things that we're seeing is the explosion in knowledge that's happening. And right now, the total amount of knowledge in healthcare is doubling every 73 days.
What?
Total amount of knowledge in healthcare doubles every 73 days.
Oh my.
So we're going to have a whole new class of people looking after that knowledge, and we're going to need technology to do it. And that's one of the reasons that the Cleveland Clinic has teamed up with IBM to bring Watson to Cleveland. And IBM is building a facility at 105th and Cedar to bring 300 high-tech jobs here to Cleveland, which I'm thrilled with.
But we got to make sure that everybody has a shot at getting those jobs. And that means a new approach to early childhood education, using technology in ways that can work. Let me just tell you two things I've tried to put in my budget I'm not sure we're winning on. One is every school board in Ohio ought to have 3 business people, non-voting members on the school board. Why? To guide curriculum. I'm not sure we're going to get it. And all teachers, when they go to get a recertification, should spend a few days out in a business. You know what the union said? Oh my God, he's trying to put them in the Army. No, I just want 3 days of them to be out in business. I want them 3 days at the pharmacy, 3 days at the hospital, 3 days in the bank. I mean, are you kidding me? We need to open this up, folks. It's our kids that are at risk. our culture and our society that's at risk if we don't move fast to embrace the technology and the 21st century attitudes that can save us from the creative destruction that technology brings. So, how is that, Mr. Ratner? Okay, good.
Let's see if we can get at least one more question.
Look, you invited me.
I know,
okay?
I know.
What did you think you were going to get?
Hi, I'm Denton Cohn, and I'm a student at Green High School. My question's about the American Health Care Act. I have Crohn's disease, which is a pre-existing condition, and I get my supplemental health insurance through the Ohio Bureau for Children with Medical Handicaps. If the American Health Care Act is passed into law, will the BCMH be affected, and could I lose that insurance?
I think we basically don't know what the law is going to be. I think it'll have very few similarities what you saw just go through the House of Representatives. I think the Senate's going to start all over again, and what we get coming out of that, I have no idea.
Well, I think that the issue of pre-existing conditions is such a big issue that I just can't imagine they're going to pass something that doesn't allow people with pre-existing conditions to continue to get insurance. This idea that we'll have a low risk or a high risk pool for people with these conditions and you can opt in, okay, it's not a bad idea, except there's no money to fund it. So, ideas that have no money behind it really, talking about an institution that puts money behind ideas to bring about big changes, you don't have any money behind great ideas, they just lay in a desk somewhere. So I think you're going to be okay, young man, and the issue of mental illness is something we need to spend more time talking about because, well, what a serious problem. You mentioned 53,000 people that died of drug abuse. I want to tell you one other thing, because I don't want to leave here without saying this. I met with the Drug Enforcement Agency. We're spending almost $1 billion a year on prevention, treatment. We're busting people. We have put limits on how much doctors can prescribe and all those things. But I met with a guy, 28, 30 years, and 32 years, Drug Enforcement Agency. I said, what do we need to do? They all said the same thing. I was afraid they were going to say legalize drugs. They said, we need to start in kindergarten, and we need to educate every single child, kindergarten all the way through senior graduation, even into college, to tell kids, stay off the drugs. They will kill you or you will go to jail. And we are not taking this seriously from the standpoint of being hands-on in our communities, in our schools, in our churches, in our synagogues. This is a war we must win. That is how we will win it. We've got to kill the demand for this stuff. Now we treat the demand. We've got to kill the demand for this stuff, and it all starts with us.
And just let me say that I think one of the things that people don't realize is what a big problem this is. And we're trying to raise the consciousness of it, and we're having both the Surgeon General and the head of the DEA here and to speak at a symposium. And I would like to invite you all to be part of that because until we raise the consciousness of the magnitude of the problem, we're not going to have a solution in this, and it's going to require everybody. As John says, the schools and churches and hospitals and law enforcement are all going to have to come together to be able to deal with this.
Exactly.
Let's go to the next question.
On the set. First of all, I'd like to say we ought to start the Toby and John show. I think it's better than Saturday Night Live. But anyway, following up on your comments, Toby, about pharmaceuticals, this question is for John, really, but I could not believe that our Congress passed a law that they cannot negotiate with pharmaceutical companies. Why don't they use their leverage? You talk about a state's leverage. How about a federal government's leverage on negotiating price for pharmaceuticals, which are driving up healthcare tremendously, as pointed out?
You want to start? Go ahead.
Well, I think, Mal, that there's just a reluctance to get into this by both sides for some reason. And look, we don't want to kill the drug companies, okay? But I think it's important to know how much of the research do they do, how much of the research gets done by government. Are they taking government-run research and then charging their own money for research? I don't know all that. What I do know, Mal, is my view is in the 21st century, in addition to the things that Dr. Cosgrove talked about on MRIs and invasive, this ability to see inside the body, the individual kind of medicine that we all believe in, that work at the cellular level, all these things are great. But we also, the pharmaceutical companies have a capability of doing remarkable things. Just think about mental illness. You know, these drugs can be a major breakthrough. So it's a yin and a yang of how much do you push them, yet how do you not disrupt them and hurt them? And I think the Congress is not taking it on, and it's a tough issue, and you become, you know, I wish they would. And I talked to President Trump about that in the Oval Office. And when I told him we needed that negotiating authority at the state level where we run our Medicaid plan, he was all for it. Called in Gary Cohn. He says, great idea, you know? And he says, Kasich's smart. Maybe I should have voted for him. So anyway, there's a general consensus that this is right. But right doesn't matter if you don't move towards something on this. And I think we could thread the needle. But Dr. Cosgrove knows this far better than I because he has to deal with it every day.
I think one of the things we have to say is that the pharmaceutical company has done wonderful things, but essentially we in the United States are paying for the research of the pharmaceutical industry for the entire world. Because we know, for example, in devices, a heart valve in the United States costs $3,000 and $300 in Egypt. The hepatitis drug costs $80,000 in the United States and $800 in Egypt. They're not selling the drug at a loss.
Right?
Yes. So they're not selling those things at a loss. So we are paying a premium in the United States, but we're benefiting from what's being developed as a result of it. So it's a balance.
How does a situation like that, I mean, how does that happen? Is that because we can't negotiate drug prices, so then the pharma can charge whatever they want? Am I getting you in hot water if I dig deeper in this?
No, you're not getting me in hot water. I think most countries in the world have a single payer, and single payers can negotiate, and we don't have that in the United States, and so as a result, they've taken advantage of that.
Got it. Next question.
Thank you, Dr. Governor. I'm Jean Polster from a federally qualified health center, so I want to ask you about coverage. I want two predictions from each of you. I hear, you know, I really follow very closely the Medicaid expansion population and Medicaid in general nationally, and also, you know, sort of the potential demise of the marketplace. So when folks like me sit around and talk, the two things come up. One is, oh my gosh, people are going to pay a political consequence if they throw all these newly insured people back into lack of health insurance. Okay, so one of my questions will be, do you think that if the new health care bill moves forward, that and people are thrown off coverage, that there will be a political consequence? And then oftentimes the other thing that people say is, oh, well, the system's just so broken that we're going to have a single payer system. So my other question is, your prediction, 10 years from now, will this country have closer to a single payer system as a way of trying to control costs?
Well, look, on the first, we don't know. We don't know what the political effects are going to be because we have developed a system in this country that needs to be changed that involves gerrymandering, where you cut off safe districts for Republicans and Democrats. And then what happens is if you're a Republican, you have to worry about a primary from the right. If you're a Democrat, you worry about a primary from the left. And what that does is it polarizes the parties. Now, if you're in a safe Republican district, will there be enough upset people in the election in 2018 in what's, quote, a safe Republican district to knock you out? Hard to say. Wave elections can do that. Is this going to be a wave election? I don't know. But I hope in Ohio, one of the things that we can get done is stop this gerrymandering and get the political parties together to say, let's make the districts more fair and more competitive, which will have a tendency to bring people towards the middle where you don't have people worried about the extremes or operating at the extremes. That would be number one. The second question, I want to take this first because I'm not sure what Dr. Cosgrove is going to say. Look, you know, the VA is a single-payer system. Medicaid is a single-payer system. Medicare is a single-payer system. I don't believe that single-payer systems bring innovation. It's the innovation that comes from the private sector, from the kind of operations you see at the clinic and from other health operations around the country, brings about innovation that's then taken advantage of by things like Medicaid, like Medicare. And it's interesting, even though Medicare is a single-payer system, you begin to see Medicare starting to act more unlike a single-payer system by now developing private health care plans to deliver Medicare through things like managed care rather than fee-for-service. So I don't think a single-payer healthcare system is the best way to go, because I think with it you lose innovation, and I think innovation is the key to everything in life, including the healthcare system.
Well, I would make 2 points here. First of all, now if you take Medicare and Medicaid, 47% of the people in the United States are covered by those two federally. And if we look right now at the Cleveland Clinic, 62% of our patients are Medicare, Medicaid, or no pay. And it's going up 1 to 2% a year. So gradually we're getting to the point where we are increasingly dependent upon that. And I think that's, there's a political fallout. Let me tell you about the economic fallout. If in fact we have a bigger group of patients who are not covered and we don't get paid for, 23% of the hospitals in the United States last year lost money, ran in the red. 55% of the hospitals lost money on looking after patients. So if we have more and more difficulty with more unpaid for patients, we're going to have an increasing number of hospitals that are going to either go out of business, go bankrupt. We're going to have increasing difficulty with the providers being fiscally solvent.
Let me tell you the one thing, though. It's like we hear talk about, you're working at this Federal Qualified Health Center, you hear about the per capita. We're comfortable with per capita because we believe we can drive, at least I am, I don't know what will happen when I'm gone, but I can tell you that we're comfortable with it because we think we can squeeze greater and greater efficiencies without taking away from quality. Now, in Medicare, the minute you go on Medicare, you're automatically in fee-for-service medicine. I mean, managed care is not what it used to be. They tell me that managed care now is a coordinated care to have your physicians coordinate you throughout the network so that the care makes sense. If you move in that direction, if you made Medicare a managed care option right from the beginning instead of fee-for-service, because now in the managed care side, in Managed Care Advantage Plus, you know, you get a lot of advantages you don't get in the fee-for-service system, and when people go into it, they don't want to get out of it. But managed care early on, I think, got a bad reputation, but it's being improved. In our Medicaid system, how do you go from 9% to 3%? How do you have flat per capita? You manage it, you know, and we're now trying to put the last population into managed care. We're having fights with people that don't want to have that happen, but I think we're making progress. And we bring innovation to that system that'll work. And that includes combining both mental health and physical health and doing them together. And so I think there's hope for these systems, but if they don't change, listen to his numbers. We got 38% of the people paying for 100% of the patients. It's really, really difficult. But again, if we work together on this and think creatively, we can get out of this.
Governor Kasich, Dr. Toby Cosgrove, I'm sorry we're out of time. I know everybody, we really wish we could stay more for the Toby and John show. But Kristen's going to close it out.
Today at the City Club of Cleveland, we have been enjoying a Friday forum with Dr. Toby Cosgrove, President and CEO of the Cleveland Clinic, and of course, Ohio Governor John Kasich, moderated by the City Club CEO Dan Moulthrop. Dr. Cosgrove and Governor Kasich appear as part of our Healthcare Innovation Series, sponsored by the Cleveland Clinic and Medical Mutual. We appreciate your continued support for our healthcare programming, Cleveland Clinic and Medical Mutual, so thank you. We thank you all for being here today, and that brings us to the end of today's forum. Thank you, Dr. Cosgrove, again, and Governor Kasich, and thank you all, ladies and gentlemen, for being with us today. This forum is adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC and the Raskin Family Fund, with additional funding from Cleveland State University, Robert Conrad, and the Payne Fund.